We have a few minutes for some questions, so please put them. I think it's best to put them. I think there's one question in the Q&A already for Dr. Siegel. Is there any capacity to use this community-based model for other causes of liver disease?
Yeah, I think the model can be used for basically any medical condition.
Sure.
I've adapted it to actually translated into Russian for the Central Asian community in Queens, where there's a very high prevalence of hepatitis B from people from Uzbekistan. Again, we did it for hypertension. It can easily be done for fatty liver disease, basically any medical condition.
Okay, thank you. One question I had, I think maybe I just can go around the screen, is sustainability. These programs are, no doubt effective, very innovative. Seem like you've already marshaled really, a great deal of support from multiple key stakeholders as well as in the communities. And maybe, Rachel, with your longstanding success, maybe yours is the one that's sustained already on a day-to-day basis. But I just wanted to call on everybody about what's the prospects for sustainability of these kind of programs? Rachel, please.
Yeah, absolutely. So I think one of the challenges currently is, Medicaid is one of our biggest payers at our FQHCs. And so really just understanding what that's going to look like in the trajectory for the future. That's one of the reasons we've been able to sustain ourselves for so long. I'm fortunate that in the state of Missouri, we have what's called Project HepCure, which has removed all of the barriers to treatment for Missouri's Medicaid payers. So there's no prescriber restrictions. I don't have to get a prior authorization to get medication for Missouri Medicaid. We also have expanded Medicaid in the state of Missouri. And so that has really helped us with creating the foundation for sustainability in our program. We also, because we're an FQHC, we can leverage 340B as well. We are currently partnering for some future projects right now, getting some state grants for sustainability, not only for our program, but looking towards creating, we're doing a rural health telehealth program at this time, and providing from Kansas City hepatitis C testing and treatment across the state. These are for people who are getting out of Department of Corrections and for people who are in rural Missouri without any other access. And we're going to be providing those telehealth services and having some grant funding to cover that. But, the sustainability for hepatitis C treatment, unfortunately, is the fact that it is still so prevalent, and we are going to continue to need these treatment, just sustained treatment models going, further into the future to be able to successfully eliminate hepatitis C. And then hopefully I won't need sustainability in my program because we're going to be right?
But that is the ultimate goal. Yes, absolutely. Please take the evaluation poll that's popped up on your screen. But I want to turn to Wes and Miranda to get their point of view about sustainability of this very innovative and effective program.
So when we talk about sustainability, I want to be clear that we're talking about the sustainability of the community paramedic going out and conducting these activities. And we had initially a $20,000 seat grant from our community to start this program. After we finished it and we cured the first 50 people, as you can see, it's very cost effective for Wes to go out. However, Wes cannot get reimbursed by Medicaid, Medicare, private insurance, et cetera. There is no reimbursement mechanism for a community paramedic. However, Dr. Roth does get reimbursed for a telehealth visit. So the hospital decided that they would pay for Wes's time to do this. So we currently are using a sustainable program. Now, it's sustainable because our hospital provides support, but they are providing support because while we have not officially done the cost effectiveness study, we know that by treating these individuals in their HCV, we are keeping them from utilizing emergency medical services and the emergency department, as well as hospital admissions in the future.
Thank you. Real quickly, you mentioned a self-pay option there on one of your slides, and I'm not quite sure what the patient is paying for. Is that the clinic visit or or what, please?
So self-pay is the way that Epic refers to individuals that do not have insurance. So self-pay means that they are uninsured. The way that those individuals pay is that we often get them on a program that I think it's who pays for the medication. Is it the company?
The pharmaceutical company.
The pharmaceutical
Yeah,
company
yeah.
will put them on a
Patient
sponsorship
assistance
to do it.
program.
Yes, and then we put them on a Prisma Health program to pay for their visits
And the labs.
and the labs.
Thank you. I thought that was the case. There was probably a patient assistance program involved. Thank you very much. Dylan, you look like you already have an extensive network of testing and treatment, so maybe this is already a sustained program, but please comment on that. Thank you.
Yeah, I mean that was the goal out the gate, is to ensure that we were growing in a fashion that would be sustainable. At the same time, as we've seen, the healthcare landscape in the United States is tumultuous to say the least. And I mean, the exciting factor here is the legislation that was just proposed with Senator Cassidy and Van Hollen, to see what comes of that for medication availability. But a lot of it is going to, obviously, for all of these programs, come down to funding. And with that, we do believe, from an Arizona Liver Health perspective, that we've set ourselves up for success longer term. But a lot of that does come at the determination of the legislation that's to come.
Thank you. And Sam, please.
I mean, I can address that based on experience. So I left Montefiore 2 years ago, and my coordinator, Fatima, has actually continued doing the outreach screening programs. She hasn't, I mean, the more advanced initiatives like the hypertension, diabetes programs had to stop because she didn't have the immediate physician backup. But she's continued doing the screening. Her funding is from the city for a hepatitis B navigator. So as long as that grant is going, she can continue.
Okay. Thank you. I think we have a few more minutes up. Rachel, your presentation brought to mind several things. In my experience, not many people refuse testing, and maybe others will have comment on this too, when they're offered HCV testing. I wonder if maybe all of you can comment on that, as well as people. I've often seen and heard about how some people feel more empowered, to do other things to improve their health with a cure for hepatitis C. Let me just start with you, Rachel, commenting on that, please.
Yeah, 100%. I think we don't get a lot of people who refuse, especially because we take an opt-out approach, right? So, okay, we just finished your blood pressure. Now we're going to do your HIV and Hep C test. It's just part of our routine with patients. Again, we try to take the stigma out of it, and making people feel like, oh, we're doing this because you have some sort of risk associated with it. We do this for everybody. This is a blanket thing. So we remove the stigma out of it. We don't get a lot of pushback. I will tell you, though, there are people who may be aware of their Hep C status. I had a patient actually, this just happened about a month ago, or less than that, actually. We were on site. He refused HIV and Hep C testing. I talked to him a little bit more about it. We were going to do some just general primary care screening labs, and I said, hey, I'll just add those on. At that time, he didn't mention anything to me about maybe previously being positive for Hep C at some point in his life. Well, he was positive for hepatitis C. We did the RNA reflexive testing, and I added some additional labs on so that we could get if he was positive, we could get him started on treatment. Brought him into the clinic for his regular follow-up and said, hey, you did test positive for hepatitis C. Oh, I knew I had that. That's why I didn't want the testing. I just didn't figure I could ever get treatment. Or I've heard in the past, I heard back in the day it was too expensive, or it makes you too sick. And there's a lot of myths around hepatitis C. And so I think part of that, urban legends that are still going around in the communities, keep people from wanting to get either the testing, because what's the point of getting tested if I can't get medication for it? Right. So we see a lot of myth busting that we have to do still. A lot of people who are coming out of Department of Corrections often get told of their status, but they're not sick enough to get treatment. right?
Mhm.
Because those are just protocols because of the way that our privatized Department of Corrections systems work and being able to provide medications to, the people who are currently incarcerated. And so again, we have to say, well, you don't have to be sick enough to get treatment. I'll treat you today. And so, again, a lot of the people who don't want to get that testing, it's either a lack of perceived risks, the stigma, or they just already know they're positive and they don't think treatment is going to be an option for them. And so it's really about providing that, again, stigma reducing opt-out approach, and then providing education to be able to reduce that kind of like myth knowledge that they believe is still to be true. The medication is still expensive, but we are able to help get you that medication at no cost, and we can show you how that process is going to be simple.
Thank you. I don't know if others have any comment about receptivity when you offer testing and how people respond once they know they're being cured. I do like the idea about normalizing access to testing rather than always focusing on the risk, making it more of a routine preventive service in my experience, starting with our birth cohort approach years ago, just trying to say this is just good for your health without tagging it to a particular behavior. For me, seems to be the way to destigmatize this whole program. So thank you for that.